We're heading down the road and a truck, semi-tractor trailer merged into our lane and we had nowhere to go. My jaw hit the window and then my other side of the jaw, on the other side, hit the steering wheel. I couldn't eat, I couldn't open my mouth. The pain was terrible. And when I did try to force my mouth open, it would click so bad, the pain was it was awful. I went to my primary first. He said that I need to go see a dentist. So I went to see a dentist and they set me up with a OMS.
Bill came to see me for a consultation for pain in his joints. He had previously been involved in a motor vehicle collision. He came in with problems being not able to open his mouth fully. He was only able to open about 2 centimeters or 20 millimeters. He was having pain on both sides of his joints, both of his temporomandibular joints. It was really altering his life and his ability to eat the type of foods that he wanted. And the pain at rest was also kind of interfering with his daily function as well.
There's nothing worse than your teeth not lining up, the pain, not being able to eat what you want to eat.
There are many options for the treatment for temporomandibular joint disorders. We typically try to start with the conservative therapy or medical therapy. So we start with putting patients on anti-inflammatory drugs to get rid of the inflammation, muscle relaxants if there's a muscular component, fabricating a occlusal stent or splint therapy. Our main priority was to get him out of pain or reduce the pain as much as possible.
Well, first they did a flushing of both joints, and the one on the left seemed to have done the job, but the right, it had to be done another 2 times, and then that still wasn't sufficient. So then they went ahead and did surgery.
He had aggressive jaw stretching exercises afterwards, and that has worked for Bill, and he's done really well.
Out of all the different doctors that I have had to deal with due to this motor vehicle accident, OMS were the best.